What is a PCL injury of the knee, and what do you do about it? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. I've talked a lot in these videos about ACL injuries, anterior cruciate ligament injuries, but much less common than those, but still important, are PCL injuries or posterior cruciate ligament injuries. If you look at the knee, and I don't know how well this model shows it, but in the center of your knee you have two ligaments that cross each other, hence the term cruciate, that stabilize the knee. The one in the front is the ACL, the one behind it is the PCL. And PCLs probably happen 10% as often as ACL tears, maybe less than that. Not nearly as common. Typically you tear your PCL with a direct blow to the front of your knee. So you're running and somebody hits you on the top of your shin bone and drives it straight back. Or you're tackled and you land on your knee with your foot in a certain position, pushing your tibia, your shin bone back, injuring that PCL. You see it sometimes out of sports in motor vehicle accidents or car crashes where your knee hits the front of the dashboard, driving that tibia back and basically tearing your PCL, basically pushing your leg back this way. Now here's the thing, the treatment is a little more varied maybe than ACLs. We think that if it's an isolated PCL injury, there's no other ligament damage, no ACL tear with it, no MCL or LCL or posterolateral corner. It's an isolated PCL injury, even a complete PCL tear, what we call a grade 3 PCL injury. If it's an isolated injury, a lot of times those do well without surgery. You do some work with a physical therapist working really hard to get your quad strength back, and you can do really well. Now, occasionally somebody with a complete tear, especially a higher level athlete for a grade 3 PCL, might still need PCL reconstruction. And in that sense, it's very similar to ACL surgery in the sense that you're making a new PCL and it takes 6 or 9 or 12 months to fully recover from that and get back to sports. But that can have good outcomes. Again, it's just surgery and a lot of work. Now, if it involves multiple ligaments, PCL plus ACL, PCL plus posterolateral corner, those are more likely to need surgical treatment. In the next injury video I do, I'm going to talk about multi-ligament knee injuries because that can be a really, really difficult problem. But if you suffer a PCL injury, talk to your orthopedic surgeon about treatment options if non-surgical treatment is appropriate for you, and work with a physical therapist really hard to get that motion and especially your quad strength back, and talk about surgical options. Okay, have you suffered a PCL injury, and what did it involve? How'd you do it? And what was the treatment? How did you get over it? I'd love to hear your experience, and I bet people all around the world would as well. I can't answer specific questions that you leave in the comments, but maybe I would answer them on an upcoming Ask Dr. Geyer video, but I would love to hear your experience. So below that video, feel free to describe it and tell us what that experience was like and how you got over your PCL injury. Now, I would love to hear the biggest challenge that you have with your knee injury so that I can give you the #1 next step that you can take to overcome it. In the link in the description below this video, it'll take you to a page where basically you can answer some questions, and I'll tell you the #1 next thing that you can do to overcome your knee injury. So click in the description box below. If you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my video channel. I record several of these videos every single week. If you click the subscribe button in the upper right corner of the page, they'll get delivered directly to you. Thank you so much for watching. If you've suffered a PCL injury, I hope this was helpful for you, and I look forward to seeing you right here next time.